Hey, good afternoon, Scurry County. It's your County Judge, Dan Hicks. I've got some news for you. It's not good news. We've had two more deaths out at the Good Life. And I'm going to read you their statement. This is a stressful and devastating time for our families, our community, and all of us in the nation. Our hearts are saddened with our recent losses. We would like to thank the Snyder community, the families, and our staff for all the love and support that has been pouring in over the past couple of weeks. This pandemic has affected our most vulnerable elderly that are on hospice. We do have it contained to one home. Our Good Life family has come together to aid our home in Snyder and will continue to do so until this is over. We are working side by side with the local health and state authorities. We are not alone. We will fight this together, and we will win this and heal together. This is from Terry McGrew, the Regional Operations Officer, and Dallin Skelly, the CEO of Good Life. So that is a total of three that have died that were on hospice out there at Good Life. That brings the total deaths that are COVID related to 5 here in Scurry County. You've noticed an uptick. We've had a large uptick in cases. So September 9th, we had 28 cases. Today, we're up to 87. That is 59 cases in 2 weeks. Right now, like I said, we have 87 active. We have 332 recovered. A total of 421 cases. I'm sorry, it's going to be 424 cases, and we have the 5 deaths. There were 17 new today, 20 yesterday, and 16 on Monday. The cases are all age ranges. It's all throughout the county. And what's causing this is, we're getting tired of it. We are ready to move on with our lives and do this differently. We're not wearing our masks as much. We're not social distancing. We're shaking hands. We're hugging. We're getting into groups. We're doing things that we started out really strong with. And we did really well. We kept our cases extremely low in the first months. But as this goes on, we get tired of doing this, and it gets harder and harder to do all of these things to keep that spread from slowing. Yeah, I know the death rate is extremely low, but every death that we have, it's horrible. I don't like it. None of us like it. We feel extreme remorse for all of these families that are going through all of this. And these folks have touched so many lives. 5 people. Think about how many people you contact each day, and we've lost that in 5 people here so far. And like we've said from the very beginning, we don't want to lose anybody to this. And so I know that the death rate is extremely low, but that's no excuse for what's happening. We still all know somebody who's vulnerable, who could get it from us if we pass it on to them and we lose them. And that's what we're trying to do today, is to get back to those precautions that we were taking before. We've got to get back to that, to where we get through this, and get those cases low. We need to protect ourselves, protect those that we love and those that we work with. There is a spike in the school district, and they're putting their information out. You can go to the Snyder School District page, and they are doing a fantastic job of putting information out. We can't expect more cases. Just right now, just yesterday, they did 99 tests. So we're getting lots of people tested, and they're doing the rapid testing. So that's coming. Where we're going to have more tests and more cases. It's also flu and strep season and allergy season. So we're seeing those mixed in there as well. We know of one case that is strep and COVID. I can't imagine having one, but much less one, but 2 of these. And so that's something I feel for that person. I have no idea who it is, but I can't imagine having both. The one constant in all of this, whether you are asymptomatic or you have symptoms, the one constant in this, like I've said all along, is that you will be quarantined. for 10 days if you test positive. So you have to think about that. That means that if your child is quarantined, they don't get to go to school, you don't get to go to work, you have to take care of them at home. Some things that we need to think about as well. I can't stress this enough. If you have symptoms, stay home, get tested, go see the doctor, use Teledoc, whatever you need to do to figure out what's going on. Stay home if you have any symptoms. It's hard to do. That's a hard habit to break, and we've all done it. We've all gone to work when we have the sniffles, or we might have a little bit of a fever, but we're not feeling too awful bad. But we're in a situation now where there's so many things going on, and there's this COVID that we have out there now that we can't control because there's no vaccine, and it just spreads so quickly. So with that information, I ask that you pray for each of those families that have lost loved ones, and I ask that you pray for those that are sick, that do have COVID or do have strep or flu or any of those things. Pray for our country to heal. Pray for our community to heal. I also wanted to tell you that we've gone ahead and made the decision to cancel May Day this week. It was going to come up this weekend. We were very excited that we were going to do this, but for the safety of our seniors who put that on, we've decided to go ahead and cancel it. Now, Tammy Quick, the director of the Senior Center, is going to get on here with me tomorrow, and we're going to talk about other options for the crafts and for the quilts and all of that. So I will definitely be on here tomorrow with Tammy, and we'll talk about that. But protect yourself, protect your family, protect those you work with, and do everything you can for them. Remember to wash your hands. Whether you agree with it or not, we're under a governor's order. We need to wear a mask. Social distance. Those are the keys to getting through this. Is protecting ourselves by wearing those masks and social distancing and all. I'm going to leave you alone now, and y'all have a good afternoon.